Okay, thank you. So I'm Gemma Robinson. I'm a senior manager in the Personal Health Budget core team at NHS England and Improvement. And I'm going to be hosting this workshop today with Tom, if you want to introduce yourself.
Hi everyone, I'm Tom Rains. I work in the PHB team alongside Gemma and I have the lead for policy.
So next slide, please. Just to do a bit of housekeeping, if you could keep your camera on if you're happy to be filmed and your internet connection allows, because it allows us to feel a little bit more together in a small workshop. If you could please mute your microphone when you're not speaking to reduce the background noise. And the format of this workshop is that Tom and I will be presenting for about 20 minutes and then hopefully there'll be about 20 minutes available, hopefully, for you to ask questions. So during this period, please raise your hand or type your question in the chat box, but please feel free to type questions in the chat box throughout the presentation, but we won't be answering them till the discussion period at the end. And finally, please try not to use acronyms so everyone knows what we're talking about. However, I will refer to personal health budgets as PHBs just because I'll be saying it over and over again. Okay, next slide, please. So during today's workshop, we'll be giving you an overview of what personalised care is. We'll also be explaining what a personal health budget is within that context. We'll be telling you about lots of ways in which personal health budgets have been used to support children and young people with a learning disability. And finally, we'll be providing you with the links of where to find further information. Next slide. So firstly, we want to give you an overview of personalised care. Universal personalised care is an all-age, whole population model, and it comprises 6 components. The first is shared decision-making. The second is enabling choice, including legal rights to choice. The third is social prescribing and community-based support. The fourth is supported self-management. The fifth is personalised care and support planning. And the sixth is personal health budgets and integrated personal budgets, which we'll be focusing on today. So this diagram shows the personalised care triangle. At the bottom widest part of the triangle in the dark blue colour, the whole population should have access to shared decision-making, choice and social prescribing, including community-based support. And people should be supported to stay well and make informed decisions when their health changes. So in the middle part of the triangle, which is the sort of lighter blue colour, we have about 30% of the population who are experiencing long-term physical and mental health conditions. These people should have access to personalised care and support planning and support to self-manage by increasing patient activation through health coaching, peer support and education. These people should be supported to build the knowledge, skills and confidence to live well with their condition. And at the very top of the triangle, in that sort of very light blue or teal colour, we have about 5% of the population who have complex needs. And these people require specialist support, which could include the provision of a personal health budget or integrated personal budget to ensure that they're able to access goods and services that best meet their needs and outcomes that they want to achieve. A personal health budget is the culmination of all 6 elements of the personalised care model. A personal health budget could be provided where it's evident that the person has needs that could be met in a more creative or personalised way, or there are goods and services outside of those commissioned that could improve outcomes for people, their families and carers. Next slide, please. So this slide shows the operating model of personalised care, and it's basically the triangle just organised in a different way, and it provides a bit more detail about how each of the components of personalised care work together. But due to time, I won't go through this slide in detail, but please have a look once the slides are circulated and get in touch if you'd like to discuss any of the elements in more detail. But for this operating model to work, it needs to engage people with a vision and willingness to make change happen. It needs commissioners and finance to get on board, and it needs people with lived experience to be involved in some of the difficult decisions that will need to be made. The workforce need to be made aware, trained, enabled and committed to providing our health service in a more flexible and creative way. Next slide, please. So what's a personal health budget? A personal health budget is one way of personalising care to ensure people get the care that they need. It's an amount of money to support a person's identified health and wellbeing needs, planned and agreed between the person and their local NHS team, or with a partner organisation on behalf of the NHS. But as I've already explained, it's more than just an amount of money. It's the culmination of all 6 components of the personalised care model, and it's a way of providing choice and control for people for whom commissioned services are not available or are not suitable or do not meet their specific outcomes that they want to achieve. Next slide, please. The aim of a personal health budget is to give people greater choice, flexibility and control over the health and care and support that they receive. It's an opportunity for people to work in equal partnership with the NHS about how their health and well-being needs can best be met. And that's about changing the relationship between the person and their clinician, from the clinician telling the patient, this is your condition and this is how it's going to be managed with the goods and services that are commissioned by the NHS, to the patient saying, this is the condition I've got and this is how it's impacting on my life and this is how I want to manage it, and these are the outcomes that I want to achieve, and these are the things that I want to be able to access to enable me to achieve those things. And it's about targeting people for whom local commission services are not working. Next slide, please. So Tom, over to you.
Thanks, Gemma. Yeah, we've been doing some work recently with people with personal health budgets, and we're wanting to ask some particular questions about how would they describe their experiences, how would they describe a personal health budget, and indeed what impact has it made to their lives. I think because we are beginning the process now, we're going to be reviewing the language we use and wanting to shift it into probably more of a personalised way of description as well. And I think what we can see here, what keywords describe a PHB, and coming direct from people who have them, we can see independence, choice, control, freedom. All of these other sorts of quite powerful feedback about the difference personal health budgets can make. And I think a lot of the time that difference comes about, as Gemma's just been talking about, having a different type of conversation, being an equal partner in the process. It really does make a big difference to people. And if we go on to the next slide as well, please, Philippa. Again, we see it again here in the impact. What impact does your PHB have? Flexibility, choice, a better life. It's liberating. You can stay living at home. And I think these, for us, really kind of demonstrate, when PHBs are working well, the powerful impact, the powerful positive impact they can have on how people live and the services that they receive as well. We've got more work to do on this. We're just at the beginning of this process, and we will be building this and combining it as we go forward. But I think it's always interesting just to have these demonstrated in a very visual way, just to help us, and again, remind us that actually, why do we do what we do, the difference that PHBs can make. Thank you. So back over to Gemma.
So at present, there are 4 groups of people who have the right to have a personal health budget. That's anybody eligible for NHS continuing healthcare, children eligible for continuing care, anyone eligible for an NHS wheelchair, and people eligible for Section 117 aftercare funding. So the right to have means that the CCG is legally required to grant a personal health budget to any person who meets this criteria and requests one, unless it is not deemed appropriate in the circumstances. And that might be where it's inappropriate for that person given their condition or the impact on that person of that particular condition. It might be that providing the services in this way will not provide the same or improved outcomes, or outcomes can be met by current services. So there's various different reasons why you wouldn't, but the main focus is on giving people a personal health budget if they want one within these right to have areas. But everyone has the right to ask for a personal health budget regardless of their particular condition. Next slide, please. So in addition to the groups of people that have a right to have a PHB, all areas of England are being encouraged to offer personal health budgets more widely to other groups who could benefit, in order to particularly meet the long-term plan and mandate expectations of 200,000 personal health budgets by 2023-24. But as well as ongoing large budgets, this might include small, one-off or time-limited budgets linked to specific outcomes. This might include budgets for carers to access a short break, people with a learning disability as part of the annual health check process, or people with a mental health condition to avoid a hospital admission. Personal health budgets can also be used to reduce health inequalities by targeting groups of people for whom commission services are not meeting specific needs. And this enables these people to access more appropriate goods and services that are more likely to enable them to achieve outcomes and manage their condition more effectively. And as I've said previously, everyone has the right to ask for a personal health budget. Next slide, please. So this diagram shows the 6-step process for providing a personal health budget to someone. And these steps are making contact and giving clear information, which includes information and advice for both staff and people asking for or offered a personal health budget. Understanding the person's health and wellbeing needs, which might include an assessment, which ideally would not be in addition to existing assessments. For example, if somebody was assessed for continuing healthcare, you might want to use that assessment to help understand the person's health and wellbeing needs, but also support the next step, which is working out the amount of money available, which gives people an idea of what they have to spend when they're thinking about the goods and services they would like to include within their personalised care and support plan, which is the next step in the process. And this is a series of facilitated conversations in which the person or those who know them well actively participate to explore the management of their health and wellbeing within the context of their whole life or family situation. The process recognises the person's skills and strengths, as well as their experiences and the things that matter most to them. It addresses the things that aren't working in the person's life and identifies outcomes and actions to resolve them. So the next step is around organising the agreed care and support. And finally, monitoring and review, which includes both the outcomes for the person and financial monitoring if the person is receiving a direct payment. So all of this process should be dynamic and may not always happen in a regular sequential way, particularly if you're looking to develop small one-off or time-limited PHBs. You may, for example, need to work through a personalised care and support planning conversation to identify what the person might need at the same time as considering the amount of money that's available. You may also need to organise some of the care and support before the care plan has been fully developed to ensure that the person remains safe. Next slide, please. So I'm now going to give you a few examples of how personal health budgets have been used to support people with a learning disability and/or autism. So the Children and Young People's Mental Health Development Programme identified 13 sites across England in July 2019. And the aim of this was to build on two prior successful initiatives. The first was the development programme with adult mental health service providers in 2018-19, which focused on Section 117 aftercare, and also the Looked After Children with Mental Health Support Needs demonstrator project. So CCGs involved in the development programme were given free rein to target groups of people for whom local commissioned services were not working and for whom they felt a personalised approach with the offer of a personal health budget could make a difference or fix a problem. They identified a gap or problem to solve within their own service and used personalised care with a small budget available as another tool in their toolbox or a missing piece of the jigsaw of support, and enabled them to access something different that really met that person's particular needs. So whilst the focus was on the children and young people with a mental health condition, a lot of people accessing the services and being offered a personal health budget actually had a learning disability or autism. Next slide, please. So this table shows a list of sites involved in the Children and Young People's Mental Health Development Programme. I'm not going to go through them all, but wanted to pick out a couple that did work particularly well and are pertinent to our discussions today. So Thurrock, for example, which is the third one down on the list, focused on improving the flow of people through their CAMS service, where children and young people were being held for longer than necessary. These children had generally completed therapy or treatments, but staff didn't feel confident to discharge them because they were worried about vulnerabilities. For example, children and young people with a learning disability or autistic spectrum conditions and people who were self-harming to manage emotions. A VCSE worker was employed on a part-time basis to work with these children and young people to provide social prescribing and personalised care and support planning. A small personal health budget was available if the children and young people couldn't be matched to relevant community assets or services. The added value of this was that the work took a whole family approach, referring parents or carers to support agencies too where needed. And further information about Thurrock's development programme, including some nice videos of people who've actually accessed a personal health budget through this service, is available via the video link. It's on the previous slide, actually. So if you go down back to the table, so if you see on the Thurrock one, you've got a purple link there to all the videos that are available regarding the Thurrock development programme, which are really interesting. So if we go to the next slide, please. So this programme has shown that small amounts of money provided as part of the personalised care and support planning conversation can actually make a huge difference to people's lives. So just to give you a few examples, a young person with an autistic spectrum condition who accessed a PHB for peer mentoring was able to improve their self-confidence to leave the house and attend social groups. 3 young people have been accompanied to the Prince's Trust programme and supported to successfully participate following outcomes in their Personalised Care and Support Plan, or PCSP. And a young person with a moderate learning disability and autistic spectrum condition established outcomes for themselves to develop social skills, develop physical activity and participate in voluntary work. And they were offered a PHB for mentoring, which was £225 for 6 sessions, which met all of the outcomes identified. So next slide, please. So some funding was also made available in the North to support personalised care and personal health budgets for children and young people with a learning disability, autism or both. And as part of this funding, Hull received £10,000 to offer PHBs to children and young people with unmet sensory needs identified through the HCP process. So the next slide, please. This is just a case study from that project that happened in Hull, and it focuses on Callum, who was 6 years old with a diagnosis of autism. He found that the transition from reception to year 1 was very unsettling, which eventually resulted in him totally refusing to go to school. When he did attend school, he appeared withdrawn and needed constant support to participate in work. And at home, he would display challenging behaviours, including hitting out and shouting. A PHB was used to pay for a sensory needs assessment and support plan, and this identified that Callum had significant sensory sensitivities, which affected his attention and made him over alert and more anxious. He had movement-seeking behaviours that helped him to stay calm, so it wasn't surprising that Callum struggled in his new classroom as it was smaller, noisier, and meant that he was much more likely to be touched by others sitting close to him. So the change in academic routine also required more sitting still, removing Callum's ability to use movement as a coping strategy. And the sensory profile also provided insight into his dyspraxia and the challenges with this. The sensory assessment enabled those supporting Callum a greater understanding of his needs and provided guidance for environmental adaptations, dyspraxia therapy, and a sensory diet that supported his movement seeking. So I now pass over to Tom, who's going to give you some more examples.
Thank you, Gemma. Yeah, I'm going to talk through a piece of work that we commissioned the National Children's Bureau to lead on. And this work began just coming up to about a year or so back. And we were interested in how personalised care interventions can better support children and young people experiencing mental health conditions and also social deprivation as well. We're particularly interested in some of those children and young people who may be falling through the cracks, who for whatever reason aren't accessing some other statutory or more traditional services. And so again, working with the National Children's Bureau, we're looking at working in a number of areas that had high levels of social deprivation, that mix of urban and rural, and looking at what their current offer was, particularly around personal health budgets and social prescribing. Again, some of the sites were at different levels of maturity, and also bearing in mind we were doing this, working in local areas during the pandemic as well, particularly over the last winter, which was particularly challenging for those sites as well. But if we go on to the next slide, please, Philippa. We had the three sites are working around Nottinghamshire and Bristol, and again Thurrock, who we've already heard about. What these areas had in common was they had existing projects, particularly targeting children and young people, some of whom were care leavers, some of them were older care leavers who had become parents themselves. There's a mixture of refugees and asylum seekers, other young people experiencing homelessness. And often what a lot of the sites were doing was looking at relatively small levels of support for the young people they were working with. So maybe a relatively small budget between, as an indicative budget, somewhere between 200 and maybe 500 pounds. And I think what was interesting is that there are often groups of people who might be described as being hard to reach or overlooked or even complicated. But I think what this research was finding that the outcomes and sometimes the support that was required wasn't particularly complicated in itself. If we go on to the next slide, please. We've had a number of focus groups and focused interviews with children and young people from the areas as well. And what came across really strongly was actually the difference that these, particularly the personalised approaches, make to them. It's about different conversations. It's less about what's wrong with you or what's the matter with you, and more about what matters to you. There's also the feedback we got about, being listened to, being accepted, the warmth of the support workers they were working with. And also something that we haven't got listed here, but I thought was really important, was that these kind of interventions were often based on conversations. What can we do to help you? What do you want to achieve? How can we get you there? Also removes the stigma of being under mental health services. We heard that an awful lot in the feedback and the research. So people felt valued, they felt whole, they felt seen, and that really makes a difference. And I think I would also want to stress that none of these interventions are kind of as a replacement or instead of statutory services. So we're going through CAMS, for example, but often they can form a bridge for people to re-engage back with those services if they need a greater level of more formal support. Have the next slide, please. Similarly here, the feedback about the benefits to their mental health and well-being, less stress, less anxiety, people feel like they're joining in and being included and being able to cope. And I think ultimately probably more independence. People are able to take more control of their own lives. For the next slide as well. We also saw, which was really encouraging, that often these levels of small support, so it might be a gym membership, it might be access to art supplies, driving lessons, relatively small levels of support, but building up. So 84% of the young people feeling more able to make good decisions. They're learning new skills, and also critically down here at the bottom, improving access back into college education and wider employment as well. So these small supports having that impact, but building those bridges into probably independent living for a lot of these young people. And the next slide here. Again, there's some of the wider benefits as well. They're often things that are very difficult to measure and quantify. There are a lot of the young people, 92%, they felt more confident. Similarly, feedback around the wider health had improved, reductions in loneliness, and actually feeling more hopeful, which is all really positive and encouraging stuff. And I think where we're at the moment, we're still finalising the final report. That will be published probably later this year. We'll also be doing more comms, and there'll be much more detail in there about exactly what all of those interventions, what the different project sites were doing, how they did it, what the challenges were as well. And also I think where there's wider learning, certainly for us in our team and the wider system as well. That was a fairly quick romp through because I'm aware of time, but Gemma, should we hand back to you just to...
Yep. So I'll just give you some further information really about where you can find more about personal health budgets and get some more information and guidance. So the next slide, please. The main place that you would go to this is the Personalised Care Collaborative Network, which is basically a website full of information, examples, guidance, webinar recordings, webinar slides, slide sets for presentations, etc., and delivery support across all of the personalised care components that we've spoken about. It is only accessible if you have an nhs.net or .gov.uk email address, or if you have an NHS sponsor. So to join, please go to future.nhs.uk, and I've put the link on the slide for when they're circulated as well. But if you would like to have access to the collaborative network but don't have a .gov.uk or nhs.net email address, please let us know in the chat box and we'll see what we can do to get you access. So just so that you're familiar with how it works, this is the first page you'll get to once you've got access. And this, this is the next the slide that we're showing now is the menu bar for all the different areas that you can go and get further information and advice through the collaborative. And I've circled the personal health budgets button there. And then once you've clicked on that, you'll come to this page. And again, you get another set of buttons. And if you click on each of those, you can access further information. And we've tried to organise things in a consistent and coherent way. But if you do want if you are looking for something and can't find it, then again, just please let us know. And there is actually a chat function on there as well, where we can you can put a message out to everybody that's on the Personalised Care Collaborative asking a question, and it is a very active forum really for asking questions, and people very often get back to you and provide example documents and answer questions and things. So it is a really good and useful way of accessing information, really. Finally, I've done a slide of national resources, which includes links to the communication guide, a PHB EasyRead document, various animations around personalised care, e-learning modules, and the NHSE website, which includes lots of public-facing information about personal health budgets that you can access. And finally, the last slide, we've done it a bit quicker this time, Tom. Any questions?
There is a question from Carol, actually.
Oh, yes.
So Carol has asked, when the new integrated commissioning services come in, will we still need separate PHB and social care budget? Carol, do you want to expand on that? Do you mean about bringing them into an integrated personal budget?
Yeah, I mean, basically at the moment, most children and young people in our area really struggle to get a personal health budget unless they meet continuing care criteria. It's really difficult. I think there's only a couple of young people who actually have personal health budgets. And I was hoping that when the new integrated system comes in, where health and social care are obviously being commissioned together, then just a single holistic budget around a child or young person could be given with the same, because at the moment, if you have a personal health budget and a social care budget, they are, the payments are made by different places, they are governed by different rules, you have two separate audits, the different forms, the individual funding request forms that you have to put in for the personal health budget. It's quite a complicated system compared to the social care, where you just have a one assessment. And you know, we're always talking about families only telling their story once, children and young people not having to repeat, but it seems at the moment the process doesn't allow for that. So I was hoping that when the new integrated care commissioning systems come in, that would be allowed for in a single holistic assessment process. Or maybe I'm just being too idealistic.
Yeah, I think that's down to the individual ICS and how they're going to be delivering joint budgets, basically. But we are doing some work at the moment to look at joint funded budgets, and one of my colleagues, Anita, is leading on that piece of work, where we're looking at what joint budgets across health and social care should look like. And one of the things that's come out strongly is that people want to be able to have one account for their you know, to support their personalised care and support plan, but anything that happens sort of in the back office functions can happen separately, but the person should see a seamless service. So they might have two payments going into their account, but actually either the local authority or the ICS needs to take responsibility for monitoring that account and feeding back to the other one. And you would have one personalised care and support plan and one assessment and one lead clinician who would then coordinate across the two organisations. Yeah, so that's how we would like to see it, and we are doing some work to sort of develop delivery support around that and working with areas that are doing that particularly well.
Great, thank you.
Any other questions? No.
I think we've got Ruth is typing in the chat at the moment.
Oh, right, yeah.
Ruth, if you just want to speak up, if that's quicker, you're more than welcome.
Yeah, it was more of just we actually currently do for children, whereby they've got they meet continuing care needs. We actually do have a joint direct payment budget, whereby it's managed by the local authority on behalf of the PHB, whereby the family do employ one direct payment worker, but actually it's jointly funded. So we already have that in place for children.
Okay.
Can I ask, Ruth, how that works when the young person moves into adult services at 18? Because we find there's quite a lot of disparity in our children's and adult services, even though SEND obviously should run from 0 to 25.
We're at early stage yet. The children who've got the joint budgets are still really small, so we haven't hit that problem yet, but I can imagine it is going to be a challenge.
Okay.
Particularly although potentially the complex of children who are meeting them are more likely to be fully CHC funded, therefore the direct payment can continue, but it'll be health to pick that up rather than it being joint. So we probably had one that transferred over because the staff of the family were employed a direct payment worker, so that worker could continue. It was just the funding, and actually the local authority still managed it on our behalf.
Okay, thank you.
Anyone else?
We've got Deborah typing again. Deborah, if you just want to come off mute, you're welcome to. Oh no, she just has to go. Okay, that's fine. I can't see any hands up or anything.
No.
Brilliant. All right, well, thank you very much, Gemma and Tom, for being with us and for sharing that with us today. So as we've said, we will share the slides, and I think you get the slides from all of the workshops round, and we'll pop this recording up online along with the others. If you haven't already, please complete the evaluation form that is in the chat there, just to let us know how useful today has been or not, and give us some feedback on your experiences. So thank you very much, Gemma and Tom, and thank you everyone for joining us, and enjoy the rest of your afternoon and evening.
Thank you.